Hi everyone. It gives me immense pleasure to welcome Dr. Amaresh, who has secured a Apex rank in the Apex exam, that is INSS, in arguably one of the most competitive fields, especially in those who are looking at systemic pediatrics, which is a lot of pediatricians are interested in. In those, I think neurology is the part where most of them are inclined towards, and it's very highly competitive. So, firstly, congratulations, Amaresh, on deciding to choose neurology, taking this courageous decision, and then going ahead, giving the exam, and coming out with flying colors. So, firstly, how are you feeling after this exam and the result?
Yeah, yeah, it is a good achievement, sir, for me. So I'm feeling very good. So I was preparing for this since last 6 7 months. Uh, so so it gives me a good pleasure uh, to have this rank and also to talk with others through your platform.
Yeah, like we've been, I think I remember you have been messaging me with respect to your doubts and everything since almost like at least 4 to 5 months, if I remember correctly. And
Yeah.
it's always so nice to see such students who have been in touch do so well. And like now coming on to the crux of your preparation, like so firstly, before we get ahead, let's make our listeners also understand where you come from with respect to your academic journey, and please introduce yourself for our listeners.
Yeah, actually, I am Dr. Amadesh. I did my MBBS from West Bengal, from Malda Medical College, and I did MD in pediatrics from Bardhaman Medical College, West Bengal. And after that, I pursued fellowship in pediatric neurology at Indira Gandhi Institute of Child Health at Bangalore, under the guidance of eminent professor Dr. Boykunta Raju. And then I started preparing for INISS, and then I this was my third attempt actually. Initially, and the second attempt I was selected for the interview by, but the marks was in the lower side, so I was not selected last time, and this time I have been selected. So this is that's all, sir.
Great. And like obviously it's a very highly competitive exam, and students would definitely want to know how did you prepare, especially for INSS, because when you think about neurology, you do want to get into the best institutes, and INSS is the path. So how did you prepare through that?
Sir, basically, my the super specialization part, that neurology part, was relatively easier for me because I did fellowship in neurology. But the thing which was difficult for me was the general pediatrics part, because I joined the fellowship immediately after passing MD, so I didn't get time to revise all the topics which I covered in during my MD curriculum in the 3 years. So during my preparation, doc tutorials helped me great in a way to help me achieve the milestone, and actually it helped me to revise all the important topics which are there in the general pediatrics, and it also helped me to secure a good rank in the INI by helping in the way of practicing the MCQs every frequently. Like I used to attempt all the GTs, or I used to attempt all the elite and all the Q banks in a frequent basis, and it helped me securing a good rank, because initially if someone being practicing the MCQ, it sometimes it becomes very much difficult for them, because initially what happened to me was that I used to make a lot of mistakes initially during my solving the MCQ, and gradually I improved after practicing every day, and it helped me to achieve that with a good rank in INI.
Yeah, I think you brought out a very good point, especially with respect to our platform. We don't have a course that is focused on INI specialty, right? So our all our units especially cater to NEETSs, and more importantly, with respect to the INI, the general part of pediatrics, the 30 questions of pediatrics that cause a lot of difficulty sometimes, especially when all our focus goes on to the specialty. And also next, the through the journey, especially when we're talking about NEETSs, there is always this confusion through these with respect to these months of September, October, November. There's always this overlap when it happens that NEET SS and INSS, they come either sometimes NEET SS first, sometimes INSS, and obviously you would also have faced this confusion. So how did you deal with that?
So actually, I was basically focused. Basically focused on INI rather than NEET because uh, I heard that there are a few seats in NEET SS in pediatric neurology, but my preparation in the general pediatrics part was not that good compared to the neurology part. So I was basically strong in the neurology. Uh, so I initially focused on INI, and simultaneously I also started preparing for the NEET SS also, as because this doctor tutorial platform helped me to grow in the general pediatrics parts also through their GTs and MCQs. But my focus was initially based was on the INI actually.
Sure. And coming to INI, there's this, big portion of 20 marks that is there with respect to the interviews. So any guidance, because students, obviously there's very limited, guidance available with respect to the interviews, especially those who are outside the INI realm. Those who are doing MD still have some, alumni to look forward to. But those who are studying outside in fellowships or in peripheral medical college, what would you guide them with respect to the interviews?
So what I can say that the interview part was relatively easier compared to the theory part, the MCQ part. There are the two categories in I mean there are two parts of the interview. In the initial part, they showed some videos, and they asked what is the diagnosis and what is the management and what is the etiology. And in the second part, they gave some case scenarios, and in each of the case scenarios, they asked what are the etiologies and what are the differential diagnosis and how will you approach these cases. And each of these cases were basically were related to some neurological disorders, related to some endocrine problem. So basically what I feel that if someone read all the important topics from the pediatric neurology and also the important topics from endocrine and nephrology, then I think the interview part will be relatively easier compared to the theory part. If someone cracks if someone do a good uh, in theory part, I think it will be relatively easier for them go through the interview part, I think.
Great. Like that would help juniors a lot, especially, I see many students who text me 1 to 2 days before the interview asking about what the pattern would be. So, and it makes it difficult to explain and them, think about it and prepare in that manner. And I think everybody, even before they get selected for the interview, they should have some idea about how the interview goes, right? And I think your guidance would help a lot in that. So Amresh, like, how did what did you prepare exactly with respect to the PEDS neuro part? Like, because that is something that also students would want to know.
So basically, I went through Nelson because Nelson is very, very important for neurology. And apart from that, I also followed Swyman because there are a few topics which are given in details in Swyman, like pediatric epilepsies, pediatric neuromuscular disease, and ataxia and movement disorders.
Sure.
These things should be written part, which is very well given in Swyman. And for the rest, other part, I think Nelson is sufficient. Basically, neurometabolic, neurodegenerative, everything is given. I think well described in Nelson. But some topics which are there in the Swyman should be read because these topics are very, very important for INI. And apart from that, they should also read some journals like ILAE protocols, and they should go through all the recent advances which are there in the pediatric neurology, like what are the new drugs which are under trial in pediatric neurology, what are the new trials which are going on. And apart from that, they should also go through all the recent publication of the AIMS faculties, which are very, very important because they often ask some such questions in the theory part as well as in the interview. So it will, I think, help them to score a better mark if they go through all these publications along with this Nelson and Swyman and these other journals like ILAE and some other journals.
Great. And Amresh, also, like, obviously this decision of choosing PEDS neuro would also
There's
be
some
a
AOSIN protocols which are there, guidelines. There are guidelines based on OS syndrome and neurosis psychosis of by the AOCN. I think all the aspirants should go through all these AOCN guidelines. It will help them to secure a good marks in the theory as well as in the interview.
And Amresh, like, how did you decide with respect to choosing PEDS neuro, and how would you guide your juniors regarding that?
So actually, in my PG days, I used to see a lot of neurology cases in my ward, and basically some of them used to get treated by our faculties and by us also, but some of those could not be treated properly because of lack of some knowledge or something. So that gives me a inspiration uh, to go by this neurology part because I thought that it will help me to give a help me to give a better treatment to all these patients who are coming in our OPD and IPD also for such neurological illness. Uh, and I think that was a big inspiration for me. And what I can say to the my juniors is that they should start reading the Nelson and Swayman properly from their MD curriculum, and also they should read all the journals. They should see all the cases which are coming to their OPD and their ward, and which I think these things are very very important for them to ultimately crack this INI, because all the questions are basically based on some practical case scenarios, and all these, if they go through all these cases, then it will help them to crack the exam in a better way.
Sure. And obviously, like, you've cracked this exam, you've come out with flying colors. Who would you like to thank, that who would have, been with you throughout this journey? A vote of thanks for everybody involved.
So basically, I want to thank all my seniors, my teachers, my mentors, and I also thank to doctoral team also, because they helped me get away. And also, I would like to thank my juniors also, because they helped me in this preparation. And
Sure. Like, it was very nice talking to you, Amresh, and it has always been, very nice and sweet talking to you through our conversations throughout these months. Thank you so much for speaking to us.
thank you, sir.